Yeah, it is live now, I think. So how we will get to know like
I
how
think
many people
people
have
number and
joined, something like
thumbs
that?
up are written there.
Yeah, 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 yeah.
So
Yes,
I
yes,
just
yes, yes.
revised
I
the
can
plan
see it
and I
now.
just gave an intimation. I don't know how many people will join for this also.
Yes.
If someone is getting notification,
I think it will throw some notification, it seems.
hmm, we'll wait for maybe 5 minutes or something. Wait, let me.
Sure, sure, sure. We will wait for 5 minutes and then we will get started. So we will wait for 5 minutes and then we will get started. So Shamir, can you hear me?
I think we'll wait for some time because people they are getting notification now only actually because this is not intimated before. That's why maybe.
Yeah, yeah, no issues, no issues. We will wait for some time. We will wait for at least 2 to 3 minutes and then we will get started. So meanwhile, we can discuss something related to the industry or something, before getting into the official topic. So we will discuss like, so Shamir, when did you pass out? I mean, B Farm, the year of passing. Shamir, can you hear me? Hello, hello.
Yeah, hello.
Shamir, can you hear
Yes,
me?
yes, yes.
So I was
Can you
not
speak?
able to hear you from the past 1 minute, 1 or 2 minutes. Yeah. So before getting into the actual discussion, let us talk about ourselves. Like, when did you pass out? I mean, like, year of passing, B Farm and M Farm, and then current status or something like that.
Yeah, actually, I passed out in this year only, 2023, from Hyderabad. So now I'm working in Dr. Reddy's. Yeah, I just started now. I did my internship also there. Uh, yeah, just starting my career
Mm-hmm.
now and
So,
helping.
what is your major? I mean, like, masters.
Yeah, my major was in
Which
pharmaceutical
branch?
analysis.
Master. Oh,
Yeah.
great. Okay, nice.
As of now, three people joined.
Shamil, yes, yes. I think we will get started.
Yes, yes, yes. Without wasting any time, I think let's get started. So, as you can see,
Yeah.
the live we have planned a sudden live. So this is not intimated before or something. Actually, we planned a Google Meet, but because of some technical issues, it didn't happen. So, as we promised today, we just thought to come on live on YouTube. So today's agenda is nothing but today with me, we have senior statistical programmer who has 7 years of more than 7 years of experience, who completed his graduation from Kakatiya University, Warangal. So he is working for a international company as of now. So I am not going to give detailed explanation regarding him. He himself will give you an idea about him. So today, this is an emerging field. Actually, for our people, many people don't know this career is existing or not. So I thought to enlighten you guys because this will help you in the long run. So here I brought him to give you an some insights regarding this clinical SAS, what it is, who can join, what are the prerequisites and all. So without a further ado, I am inviting, I am giving the chance to uh, Sanjeeva sir. He will take care of the session now. So it's like we can keep it as an introduction. You can, uh, sorry, we can keep it like a interaction session. So you can ask your queries and all. So he will be answering the queries. So without a further ado, sir, it's yours now.
Yeah, thank you, Shami. Thank you for for organizing this session. Actually, it's a sudden note. So we were planning for a Google Meet. Yeah, unfortunately, yes. So as you know, my name is Sanjay Reddy. So I'm working in London, UK. I'm a senior statistical programmer. So I completed my graduation from Kakatiya University, Warangal in 2015. So after completing my graduation, I was working for a pharma company in quality assurance department for 2 years. But I thought, pharma company is not meant for us. I mean, like the salary I was getting very low, and whatever we have studied, I mean, the B pharmacy, the standards that we have, studied, and the work that we are doing in a pharma company, I thought it's, kind of unbalancing. So I thought of, moving into some technical side.
Okay.
Then I got to know about SAS from my senior. Then I started learning in 2017 January. I sat for almost 9 months, and then I've got an opportunity to work with one company in Hyderabad. And then I moved to Kerala, and then Bangalore, and then London. So it was a beautiful journey of 7 years.
Okay.
So many people, many people who have studied pharmacy, or who are studying pharmacy, they didn't know about this IT sector, like programming, healthcare data analyst, clinical trials data analyst. So these all are highly payable salaries, just like software engineers. Okay, but unfortunately, due to the lack of proper guidance, our people are moving to formulations or pharma companies, or regulatory affairs, or something which are not highly payable, so they're getting depressed. So to educate our pharma people, we have started this statistical academy. So we thought of sharing knowledge as much as possible. So yeah, that's why I started this. So clinical SAS. So as we know, clinical trials, the drug development process and all, there are four phases, and there will be, patients. We will be giving drugs, and we will be getting data. So that we will work on that data to standardize it and to share it with the regulatory bodies. So that's how it works.
Okay, okay. So as a fresher,
Yeah. So what kind of question you
as
want
a
to ask?
fresher,
Yeah. Yeah.
I will ask some queries regarding clinical SAS because most of the people are having these queries. So, as a fresher, what are the prerequisites a fresher should have to enter into clinical SAS? We need to go for coaching or not, or directly we can enter
Yeah.
into company or not? Is there any programming language history required, or something extra required to join this SAS or not? Could you please briefly explain regarding that?
So this clinical trials data is being handled by a software called SAS. Okay, so this is a programming
Okay.
language. So there are set of guidelines, like we it is called CDISC. Okay, Clinical Data Intelligence Standards Consortium. So whichever the clinical trials study which is being submitted to the FDA, which should be preparing CDISC data sets and analysis. Okay, so that part should be covered by this software called SAS. So the people who wanted to come to, who wanted to choose this career, career option, they should learn SAS. Okay, so some companies, very few companies, will conduct campus placements directly in the college. Those who are in the final years of students, like BSc Statistics, MSc Statistics, BPharm or MPharm, very few companies, what they will do is they will go to the campus and conduct the campus placements, and they will select the candidates without SAS knowledge itself. They will select the candidates, and once they are done with their course, they will directly go to their companies and sit there. They will teach their SAS and all the standards, all the process. That's how they will get job. And so 95% people, what they have to do is, so they have to get trained for SAS programming language. They need to learn the programming language, SAS. Okay, once they are perfect with the programming, then they will go for clinical expertise, clinical domain. See, SAS is the programming language. You should know how to write a program. You should know how to generate a output. You should know how to work on it. Okay. So once you are able to work on the SAS platform, what we are doing with the clinical data with this SAS, that's it. That is the clinical domain. Okay. So we need to learn programming, and we need to learn how to deal the clinical trials data. So that's how it would be. Once you are going through this training program, and once you are, you feel like you are, I'm ready to take a job or something, then you need to keep your LinkedIn profile ready. You need to do some background groundwork to get the job. Okay, so that's how it will work.
Okay, okay.
So you might be having some doubts, like whether, yeah, 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 go ahead, Shamir.
So,
So far,
as
any
a fresher,
questions?
how much time it will take to get a grip on this programming language and all? So, as you have 7 years of experienced person, so how much time it will take to get a grip, like a fully fledged manner we can work on this SAS programming and all to deal this data, all those things.
Yeah. So to learn SAS programming, it will take around 3 months. If you spend at least 2 to 4 hours of your daily time, it will take around 3 to 4 months to get perfection.
Okay, okay,
Okay, and then for clinical data and data handling analysis and that part, it will take around 2 to 3 months at least. So it will be around 6 to 7 months of time.
okay, okay, okay. So, as a fresher who are
Yeah.
stepping out to this clinical SAS, irrespective of this pharmacy and industrial jobs, R&D, all those jobs. So, what are the perks being in clinical SAS? So, could you please enlist some of the perks what we will get in this clinical SAS?
Yeah. So as I am from a pharmacy background, okay. So initially I was working in a pharma company. There I was getting very low salary, okay, and the future prospects. Let's say, for example, if I were to stay in that pharma company, I would have stuck at the salary of 50K Indian currency. Okay, it's been 7 years. Still, I would have been at the point of 50K or 60K Indian salary. Okay,
Okay, okay.
that is one
Hmm.
thing. And the other thing is, I wouldn't have get a opportunity to. I mean, I would not be able to get the international exposure. You know, if you are working in a pharma company, then you will not be able to go abroad on a job
Yes,
purpose.
yes.
You will not be able to get a job abroad. Okay, very rare scenarios you will get in the R&D, regulatory affairs you will get. But but if it has to be a technical thing, then it will take time for you to get the international exposure. If you want to go out, if you want to explore the rest of the world, it will take much time. So since it is a technical side, since it is a programming language, it will be quicker for me to get exposure around the world. Even when we are working, when we are working in India, we will be having our colleagues across the world. So that's the perk. We will get exposure to different. We will be diversified. That's the thing, and we won't feel pressurized. We won't feel anything like that. It will be very cool. It will be like you are playing a video game.
Okay, okay, okay. So
Yeah.
these are the things about a clinical SAS. So we have few audience over here. If they have any queries, they can type in the chat box and let me know. Otherwise, I will ask a few more questions.
Yeah, yeah. So if you, yeah. So we have around four
Yeah, yeah.
participants, it
Because
seems.
this is
So if you
not
have any
a
questions
informed
so far, you can ask
live.
us.
I should have informed in the morning or something
Yeah,
today.
yeah. It's an interactive
Uh,
session. Yeah. So whatever you have, you may have some questions in your mind, right? Just please post it so that we can answer them. Yeah. Sir, after B Farm, how to get into this domain? Yeah. Hi, Kishan Kumar. A nice question. So the people who are in let's say final year of pharmacy, or you just passed out of this college, then what you should do is, there are so many coaching institutes, coaching programs. We are also offering a intensive coaching program. Yeah, so you can just reach out to us through our mail IDs, which are mentioned in this channel about section. Then we will guide you forward throughout this course, how it will be, and what you need to do. So all the things we will be sharing detailed through a mail.
so one more query was there actually.
Yeah, yeah, yeah. And we have also uploaded so many videos on our YouTube channel, how to get started, how we can use this SaaS software, what kind of job roles that are there, what kind of companies that the people are, resources are already available on our channel, and still we will also upload in future as well. Yeah.
So is there any further queries? What I am telling is don't take this lightly. uh, even coaching centers are available or something, you won't get a proper guidance for this, because this is like a dry thing. Most of the people are not aware about this. uh, and there are many coaching centers, but they don't know actually what they are doing, and they are giving false hopes for this placements and all. So if you are paying a chunk of money, you will end up in nothing. So you have to do it from a senior person who has gone through and who has a exposure to this field especially. So then only a proper guidance you will be getting. That is what my take is. This is not a promotion or something like that. So we are just sharing our things to get a betterment to the
Yeah.
future pharma aspiring students. So you can shoot up your queries.
Yeah. So why we have started this live, or why we have started this YouTube channel and all is, so I was struggling a lot to get a job. So to remove that, to avoid, you know, to I don't want you people to go through the struggle which I have been through. So that's why we have started all these sessions, all these training programs, Instagram, YouTube, and all. Yeah. So whenever we have some time, we are just uploading videos. We are just,
Yeah,
out
yes,
of
yes.
curiosity, we are reading papers, something like that, and sharing these kind of sessions.
Is there any queries out there? So you can shoot up your queries.
So, Shamir, actually, so we will also conduct a live session next week
Hmm.
on Instagram as
Yeah,
well.
yeah, yeah.
So, but we
With the
will
prior
inform
intimation, we will
priorly.
do
Okay.
like with the before 1 day or something. We
Yeah,
have to
yeah, yeah. Even
intimate. Then we have to give maximum publicity. Then only people will join. Even in YouTube also, that only will work,
exactly,
because
exactly.
last
Because
time.
many people are ready to join actually.
Hello, you carry on, sir.
Yeah, yeah. Actually, many people are trying to join. I mean, many people will try to join, but they don't know. They don't have information
Hmm.
actually. So we will, from today itself, we will just promote it, and we will conduct a session again on Saturday, next
Yes,
Saturday.
yes, of course.
Yeah. So if you don't have any questions, then we can, end the call.
Yes, yes, yes. I think that's it. Without prior intimation, I think we can't pull off many audience. That is the problem here. If the video will be
Exactly.
there in channel, but if there are live presence of audience, that would be a more interactive session, more of an interactive session. So
Yeah, that will be more
yeah,
interactive.
yeah,
Yeah,
yeah.
yeah,
Because we
exactly.
can't
Yeah.
simply discuss things, because we know the things each other. So if there are any queries only, we can discuss all those things. So definitely we will come another live also. So for the time being, we can call it a day, I think.
Yeah.
Yeah.
Okay, Shamir. Bye. Thank
Bye.
you so
Thank you.
much.